Well, it's Monday morning. I got a lot to do today, and one of the things I want to look at is Aztec's leg. He came back from Auburn University on Thursday, and to say I'm disappointed in the care would be kind of an understatement. So let's take a look at it. I will warn you now, this is kind of graphic stuff. It's a large wound, so it's kind of gross. There he is, peeking out the window at us. Good morning, everybody. First thing I gotta do is get everyone fed because that's all they really care about right now. And then we'll take a look at his leg. Here you go, donk. Son, did you make a mess in here or what? Good Lord. I have to soak Texas food because he doesn't have a lot of tooth left on the top and in the back, so softer food for an old man. All right, got all the horses fed. That's priority number one. I've got to go let the goats out there and they're making noise. So Aztec came back from Auburn University on Thursday this past week. He's been there roughly 8 weeks. I think he went there beginning week of April, maybe. Sometime in April he went. Had to have surgery. This was surgery number 3. This time they removed most of his sheath and rerouted so that when he urinates it comes out the back. Previously he'd had cancer. He'd had 2 surgeries in the sheath area, penis removed. The second surgery that they did, which was the first surgery for this owner, they left his sheath intact and urine was just sitting in there, which was causing it to swell, causing more problems. He probably should have had this surgery the first time. So anyway, he's there. They do the surgery. The sheath is fine because most of it's gone, but it's healing up quite nicely. But he developed cellulitis in his right leg, and I can only attribute that to the surgery and probably the care immediately thereafter, because it progressed to the point that he's missing most of the skin, and here's what it looks like. So when he stepped off the trailer, there was infection. There was nasty pus all over this thing, draining from 4 major spots that I could see, and I'll show you those here in a second. But he's on no antibiotics, and I don't think they ever sprayed any kind of, medicine, antimicrobial, any kind of gel or anything on there to protect this, to help with the development of granulated tissue, to prevent infection. Maybe he was on antibiotics when he was there, and he's had so many that they don't want to put him on anymore. I don't know what the answer to that is because he's not my horse. I'm not privy to all that information. But what I can say is for a horse to come here looking like this is unacceptable, coming from a vet's office with that reputation. All right, well, let's go get the goats. Yes, I know we're all starving. Get down, get down, get down, get down. Do you see the food going in the trough? Do you see the food going in the trough? All right, well, if y'all are ready, this is what we're working with 4 days later. Now, I haven't cleaned this up, obviously, this morning, but when he got back, all of this, I didn't have any pink skin. You see how it's getting some new skin here? This was all pus. I mean, lots of pus. And behind, we have one spot here, which is still got a lot of infection coming out. Nasty, nasty, nasty. That spot's actually half as big as it was on Thursday. So I'll clean all this up, and he's not really going to like it, but we've got a lot of, this was all very deep. You see how the granulated tissue has started to come out to the edge of the skin. We got some new skin growing here. It's doing a lot better, but I still got a lot of infection up in here that has to drain out. So I'm gonna set the camera up over here and I'm gonna get busy with the hose debriding this. Of course, you're gonna need gloves. So I've got good 6 mil rubber gloves, paper towels, clean paper towels, and antimicrobial, antibacterial spray that I'm gonna coat this with. And that's how we're treating it right now. Like I said, I would prefer him to be on an antibiotic, but I'm not a vet. I do think he needs one, but it's entirely possible that he's had so many that they don't want to put him on anything right now. Yeah, I know, buddy. First order of business, I'm gonna get all the stuff off of his lower legs with the jet. Cold hosing helps with the inflammation, as does walking. He has walked off quite a bit of the swelling. His lower leg was really almost double its size when he got here, but it's doing a lot better now. And cold hosing helps with that quite a bit. That and Epsom salt, that's two of the best things you can do for lower leg swelling in a horse. With race horses, we used to use a combination of rubbing alcohol and glycerin to reduce that after they came off the practice track. But just a good cold hose and some Epsom salt rub does wonders. All right, buddy. Time to get up in that bad one. I know. And a lot of the removing of the bad tissue can be done without, really causing him a lot of discomfort. I have this on full. I don't have the full power to the nozzle. And basically I'm just rinsing off all this drainage from the night before and getting it back down to the new tissue, but without doing anything to harm the new tissue, because granulated tissue bleeds quite a bit. It's got a lot of capillaries in it, and what you don't want to do is damage it, because we want it to fill out. And that's what's going to close this wound up. So now I'm going to put on my gloves, and I am going to pat this dry, picking off any dead stuff I see. Very important step. You got to get this dead, nasty skin and drainage off of it before we put the medicine on there. And that's what's going to coat it for the day. And I'll come back in here after lunch and do the same thing all over again. All right, got it cleaned up. Back in with some Pura Shield. I'm gonna coat it with some of this. And of course, all around him, had a lot of gnats, a lot of flies going on this time of year. Getting all the good areas around it. Try to keep the bugs off of him. As you can see, that puts a really heavy coating on it. If I can just fix this, where all this infection is, if I can get that cleared up to where we're getting this good growth like you see here, granulated tissue, I'll say this has been a really successful treatment. He will recover. He will get the skin back. The swelling, a lot of the swelling is gone. He's still favoring it. Obviously, it hurts like hell. But I think the fact that he's eating very well, he's drinking a lot of water, he seems to enjoy going out with the other horses. And this side was as deep as the other side. And now the granulated tissue, which is the first step for them healing, is starting to fill out this wound bed. And we got good pink tissue, which is what we're looking for. And that's why you can see on the very edges, you got some new skin forming. And that's what we're looking for. So hope that helps. You get one like this, you are going to have to treat this 2 to 3 times a day for weeks, if not months. You can turn them out. I've seen guys, turn them out, let them heal. That's a good way to net with a dead horse, in my opinion. Maybe it works in your part of the country. It doesn't work in mine. Tex had a very severe leg injury where he peeled the skin down after getting hung in a fence, and he doesn't even have a scar now because I dealt with it. I would wrap this if it were not for the infection, but I don't want to trap any infected drainage in on the wound because that's just going to make it worse. All right, well, I know that was gross, but can't say I didn't warn you. Aztec is out here somewhere running around. I'm gonna leave him out for a while. He's still favoring it, but he's got to walk around. He's got to get some of this stuff worked out. Obviously, I don't want him running. I don't want him doing anything to stretch this wound, but he doesn't typically do that anyway. He likes to just walk around and eat. And the other horses don't really bother him. He hangs out with the goats and with Selena. So I'll leave him out. I am happy with the progress he's making. I still can't believe he was sent home in this condition with the amount of infection that was draining out of his leg when he got here. But he is showing a lot of improvement, which tells me they weren't putting anything on this to begin with. Maybe washing it, debriding it a little bit, but you've got to coat it with something to kill the bacteria and everything else that's getting in it. But since he's responding well, he should make a full recovery. Just a matter of getting rid of that last bit of infection that's up on the inside of his leg. So I'm gonna get busy doing the rest of the chores. Until next time, thanks for watching. Why are y'all still in the barn?